Doctors are working around the clock these days to combat the growing and seemingly endless coronavirus epidemic in what is one of the most challenging times of their careers. To help combat fatigue and provide much needed self-care and support during this challenging time, malpractice insurer PRI is offering weekly online peer support programs that are open to all frontline medical professionals. Hundreds of doctors have already participated in the program and more are joining each week. Here to discuss PRI's program and how it's been helping doctors is Dr. Tristan Mueck, Assistant Medical Director with PRI. Dr. Mueck, thank you very much for joining us today.
Pleasure being here. Thank you for having me on the program.
Let me start by asking you, what suggestions can you offer to doctors for coping with the feelings of stress and exhaustion that so many of them are experiencing now from treating coronavirus patients?
Well, I think the first thing I'd like to say is that is to recognize the tremendous gift that physicians and medical providers are giving to this country and to society and their communities. And I think it's important to point that out because physicians right now may be facing, could you imagine the degree of catastrophe if we didn't have our physicians and medical professionals during this crisis? It would be an unimaginable event. And I think it's important to point that out because very often we've been doing peer support now for 7 years, and we were taught how to do peer support by Dr. Joe Shapiro from the Harvard Health System. And one thing when we went through her training program, she taught us was that when she's dealing with physicians who are suffering either after making a medical error or something like that, is that they tend to focus on the negative things that specific to either that event. If they were getting sued, they focus on that, and they tend to lose sight of all the good things that they're doing and the contributions they're making. So I think it's very important for physicians to look at the big picture. They really are sacrificing themselves and in many ways putting themselves and their families in jeopardy in order to make a great public contribution. So I think that that's very important that they keep mindful of that fact. I'd also say that I think that many physicians may be dealing with approaching situations that they haven't approached before. They may be seeing a degree of suffering that they're not used to seeing. For example, we've seen dermatologists who are now working in the emergency room and anesthesiologists who are now working in the intensive care unit. So those experiences can make physicians feel worried and anxious that they're not doing as good of a job as they can be doing because they're doing things that they aren't familiar with doing. And that can have, I think, that can impose moral injury on a physician, and they can become hyper-focused on that. So I think they need to be mindful of, this overall good that they're contributing. And I think they also need to process these experiences because when they see these things, or if they're engaged in caring for people or making decisions that might adversely impact one person over another person, where you're having situations of choosing care between one and another, or staging care, those experiences will impact the physician, and they need to process those. In our program, we have a formal program for processing those that's led by a group leader. But a physician doesn't need to participate in a formal program. It can either be done at the point of care where they have a colleague that they can speak with about these experiences, and a group of friends, I think, can be supportive. I also think physicians need to be, many physicians have isolated themselves from their families to protect their families. But at the end of their day, they need to have an end to their day, and they need to not carry around the load with them all day. They need to be able to go home and engage in sort of activities that they find renewal from, so that the next day, their next shift, they feel refreshed and ready to go, because otherwise they're just going to burn out. And I think that that's sometimes in a crisis like this, it becomes harder for you to engage in those activities that you derive self-renewal from, because they can feel self-indulgent. And I think physicians need to be really careful about not going down that road and perceiving self-care as self-indulgence, because they're not the same thing at all.
You used a term a moment ago I'd like you to explain a little bit more. And that was moral injury. What does that mean?
So moral injury was really first described in, there was a book by Jonathan Shea, and it was called Achilles in Vietnam. And in that book, essentially, Jonathan Shea describes sort of post-traumatic disorder as sort of an experience where, in this case, soldiers had to make decisions or had to encounter situations, say, that normally, so for example, if in this context of a soldier in Vietnam, an ambulance would be, or somebody would come in with a baby and ask you for help, and then the baby would really be a bomb, say. So now you're associating something of where you would help an infant with a baby with something that's actually harmful to you, and you start having to make decisions not to allow that person or not try to help that baby. And that actually imposes a injury, a psychological injury on making that decision. So in healthcare, this would be, I think we've all heard on the news about, a scarcity of ventilators and making a decision where, maybe you had to put another person on a ventilator or discontinue somebody, you would think prematurely. Normally you would have kept the person on the ventilator another day, but you're going to have to withdraw ventilator support earlier than you might ordinarily in order to put somebody else on it. I think that decision is a moral decision, and you making that moral decision can impact you negatively. We've had, for example, we've had somebody in our groups talk about somebody was in urgent care, and the person came in and had COPD, the patient, and normally at that level of oxygen saturation, they would have sent the person to the emergency department. But because of new guidelines that have been put in place for the coronavirus, they wouldn't send that person to the emergency department. So 5 weeks ago, they would have handled the patient's care differently. And for physicians who are geared towards taking care of patients in the best way they can, having to make those types of decisions can make them feel really like they did something wrong and committed an injustice. And it can be a source of self-directed cruelty in a way, where they don't process that and they feel harm from that, and they sort of live with that and carry it around.
A moment ago, you referenced the need or the importance of self-care for doctors. How do they do that, though, when they are working sometimes 15, 16, 17-hour shifts?
Well, I mean, I think that is in fact, in those cases, I think it's even more important to be even more attentive when you're not working. So throughout the day when you are working, I think it's very important. Physicians can often sometimes forget to go to the bathroom, or forget to even eat, or forget to drink, and they just keep going and going for hours, and then they don't schedule in time for themselves, even 5 minutes to, if somebody likes mindfulness and does formal mindful meditation, they can take 2 minutes to do something like that, or have a discussion with a colleague that they find, whose company they find enjoyable, or take a minute and call a family member that you've been thinking about, or somebody that a loved one, and have a conversation. All these types of things, or just take 5 minutes in your day, at scheduled intervals, just to do whatever it is that you find helps you recharge a little bit. And then I think when your shift's over, or the end of your 17 hours, you need to take time to really, I would say, unpack that load at the end of the day. So in mindfulness, one of the 7 pillars of mindfulness is referred to as letting go. And it can be very counterintuitive for a physician to let go. So at the end of the day, how that would work is, at the end of your shift, you need to sort of take that rock that you're carrying around and leave it outside your door, so to speak. And when you walk into your house, not bring that with you, so that you're engaging in family life in a way that you normally would, because we all derive benefit from our family life. And talking about your son or daughter's day may seem trivial sometimes when you've just come from a situation where people are suffering, but it's extremely important to do that. And then I would say another thing that often gets overlooked, and it's chronically an issue in healthcare, is sleep. So we have a lot of sleep disorder, chronic sleep deprivation. So a physician who goes 17 hours of working, 17 hours without sleep is the equivalent of having a blood alcohol concentration of 0.05%. So it's very important. It's often overlooked. In fact, oddly enough, it's still debated. I think the data is very clear that sleep deprivation causes a significant deterioration in task performance. For example, there's about 6 times the amount of needle stick injuries that occur. And that's an example of task performance when people are sleep deprived. So they're suturing skills and they're drawing blood and they stick themselves with a needle. There's 5 times the amount of diagnostic error, 36% increase in medical errors when people are sleep deprived. One of the things that we've learned when we do peer support, and a sign that somebody is struggling, is when they report that they can't sleep at night. And how this can manifest is, something happened in their day and they get home and they're laying in bed and they're sort of replaying the events over, particularly if there was something that didn't go well. And they sort of play them over and over, and they can't sort of put that aside. And I think that if you're experiencing those things, it's very common, but it's also very important to reach out for help, and that can be hard for physicians to do, but it's important even to reach out to a colleague. Again, it doesn't have to be a formal support program like the one we offer, but it's important not to feel isolated, because isolation is really one of the worst things that can happen. And again, that's very common, especially nowadays when physicians are isolating themselves deliberately from loved ones.
When a physician reaches out to you as a fellow physician for help, what is the best way to help that doctor?
Well, it's in some ways depends on the preferences of the physician. In our case, we have a group of peer supporters who are trained to be peer supporters.
I'm sorry, I didn't make the question clear. I meant how can doctors help each other?
Oh, okay. So I think one doctor helping another. So for example, a colleague speaking with another colleague, I think the first thing to do is to be a good listener to your colleague. If you're speaking with somebody else who is expressing, who's telling you about a story or an experience they had, to listen to that story and to be present in the telling of that story. Dr. Mueck talks a lot about that as just being healing in itself, not allowing somebody to be sort of in the glare of this problem that they're experiencing by themselves, but providing them company. That alone is very valuable. And if that's all you do, that is very valuable. What I mentioned before about reminding physicians about other people that they've helped successfully and the good that they've done helps them to refocus away from just the negative event and remind themselves of the good that they're doing. Even offering to touch base with that person, say, hey, look, you're having, I'm going to call you tomorrow and let's discuss this further at the end of that day. And checking in with that person, I think, can be an incredibly healing way of showing that person that they're cared for and they're important. And when it comes from a colleague, I think that's especially important. A valued, trusted colleague those things are very important. I think inquiring, are you getting enough sleep? Encouraging them to keep doing the things that the activities that they find that they derive renewal or benefit from, whether it's exercise or whatever leisure time activity that they engage in that they derive any type of pleasure from, is important to encourage them to do those activities. So hearing that from a colleague, a physician that you trust, is incredibly powerful and incredibly beneficial. And I think that's really important. There's informally, colleagues can be incredibly beneficial to one another in this time. And I think generally, it used to be that's how these things were handled. You had a physician community and physicians would gather together. And as physicians have become siloed off in their work, they don't gather together in any sort of community sense. So I think it's more important now for them to deliberately reach out to one another. Sometimes when physicians are struggling, they're going to be in a position where they don't reach out, which is incredibly unfortunate, but it's a sad reality. So checking in with your physician colleagues. If some physicians are actually, the reality of the situation is that we have some physicians who are working in some cases beyond the limits that they might be, that should be expected of them. And we have other physicians who may be not that active right now. Surgeons who do mostly elective surgeries are not that active, and they can actually serve as a support role for other physicians as well, and check in with their friends who may be working in these types of situations where they're exposed to this type of suffering and grief and so forth. So I think that you don't need a formal program. We offer a formal program, but physicians, I think, can do a lot to help one another.
Thank you, Jeff. And don't forget to check out the websites of these MJH Life Sciences brands and more to get additional information across the medical field.